It affects about 1 in 30,000 individuals, or if you do a little different math, it's 3 per 1 million. And if you're doing a little more math, that translates to about 11 to 12,000 individuals that should have Wilson disease in the country, in the U.S. However, there are only about 2 to 3,000 persons who have been diagnosed with the disease in our country. So it's obviously that this disease is underdiagnosed, or more likely or more appropriately misdiagnosed, with a variety of different liver neurological or psychiatric disorders, because it affects multiple systems. So the Wilson disease protein does two things. The first thing it does is it incorporates copper into ceruloplasmin. The copperless ceruloplasmin, or apoceruloplasmin, becomes ceruloplasmin in this process, and this copper is excreted in the portal system, bound to ceruloplasmin. So that's function number one. And function number two, and perhaps more important, is the fact that it directs the copper to the biliary system for excretion. So this is normal physiology. The Wilson disease protein, because of a number of mutations, now numbering over 700 of them, leads to aberrant Wilson disease protein action. So two things happen. One is copper incorporation into ceruloplasmin is diminished, and that apoceruloplasmin, the one without copper, has a much, much lower half-life than the copper-containing ceruloplasmin, leading to the low ceruloplasmin, which is, as you'll see, typical of the diagnosing Wilson disease. And the other thing that happens is that there is now a diminished copper transport to the bile, leading to lack of excretion and accumulation in the liver cell, and increasing the copper load, where then it's deposited in various liver tissues, the cornea, the Deschmetz membrane in the eye, leading to the Kaiser-Fleischer rings in the kidneys, leading to kidney disease, and the red blood cells, leading to the well-known Coombs negative hemolytic anemia that can be seen in patients with Wilson disease. Because of the accumulation or the deposit of copper happens in many, many different organs, you're going to have very many different clinical manifestations. From a liver standpoint, you see the whole gamut of liver disease, from asymptomatic elevated liver tests all the way through acute hepatitis, chronic hepatitis, cirrhosis, and acute liver failure as a presentation of the liver disease. I've already mentioned a little bit about Kaiser-Fleischer rings, and that's, again, deposition of copper in Deschmetz membrane of the cornea. In the brain, copper can accumulate or deposit in the cortex, the thalamus, and substantia nigra, and so it leads to a whole variety of neuropsychiatric symptoms, including personality disorders, mood disorders, psychosis, cognitive impairment, drooling, difficulties talking, difficulties walking, difficulties writing. In the blood, I already mentioned the Coombs negative hemolytic anemia. In bones, it can lead to osteoporosis, osteoarthritis, joint pain. And in the other organs, I may have mentioned renal disease. And in the heart, you could get cardiomyopathy. You could get arrhythmias, very importantly, particularly supraventricular tachycardias. You could get tubular dysfunction, nephrolithiasis, aminoaciduria, hyperuricemia, and hyperphosphaturia. So again, a wide variety of symptoms can be related to the deposition or accumulation abnormally of copper in tissue. So the diagnosis of Wilson's disease, like the diagnosis of many other diseases, it would be ideal if we had one single test where if it's abnormal, you have the disease, and if it's normal, you don't have the disease. So that would be the gold standard. However, for Wilson disease, such test does not exist. And so we're left with having to look at a number of things in order to make the diagnosis, which makes it oftentimes a little difficult to reach at a confirmed diagnosis.